This is Dr. Aisling Whitaker from Bitehaus Dental in Toronto, and I'm excited to show you how we use Invisalign as an alternative to braces in growing smiles. So let's get started. Let's talk about some of the reasons that we may choose to treat children early rather than waiting until the preteen or teen years. The first thing as a dentist that I look for is whether or not I need to protect the incoming adult teeth. If the front teeth, for example, are in a position such as a crossbite or a deep overbite, I know that these teeth are at high risk of chipping from grinding or just using them daily to chew before they get a chance to be treated with braces. I have seen so many children with teeth in these positions who have needed front teeth fillings and need these ongoing throughout their lifetime. Another reason is if the teeth are very far forward in what we call protrusion or a bucky smile. These children often trip and fall or have sports injuries that lead to breaking their front teeth. So I want to get in and treat these teeth early so that I can put them in a position of protection. A second reason why we will choose to treat early is if the child has a very narrow jaw or their back teeth are in a crossbite where the upper teeth are on the inside of the lower teeth. We know that we can expand the palate and allow the upper and lower teeth to fit together like the lid on a pot. Another reason, even if they're not in crossbite, is if the mouth is very narrow and won't allow all space for incoming adult teeth. Our philosophy at Bitehaus is to avoid extractions later on in orthodontic treatment. So if we need an expander, we like to get in early and do it between the ages of 7 and 10, the younger the better. A further reason for treating early is if we identify habits that could be leading to non-ideal growth. Examples of this might be thumb sucking, past pacifier use, or ongoing tongue thrusting habits. We like to train the tongue to rest and swallow in an ideal position so that we can reduce the non-ideal growth that is happening. This in turn can promote nasal breathing and reduce grinding on the front teeth. A final reason that is often overlooked is the social implication of having teeth in a non-ideal position. We know that aligning the teeth can lead to increased confidence and emotional well-being in the preteen child. We start our cases in a stage 1 treatment, which consists of doing an expander for the upper teeth if it's needed, and addressing the habits that the child may have. This allows us to create space for the incoming adult teeth, and we get to address mouth breathing and habits that may be contributing to non-ideal growth. At the same time, or right after, we can correct the overbite and the crowding of the lower front teeth. This reduces the risk of grinding and chipping these teeth, causing damage to those teeth when they're in the early years. So what does this look like? We typically start with an expander on the top and Invisalign on the lower, which can be done at the same time or one after the other. We start between 7 and 8 years old, and treatment takes about 12 months. Once the 4 upper front teeth and 4 lower front teeth are in an ideal position, we then put your child into removable nighttime retainers while we wait for their side teeth to grow in. The next stage of treatment is typically the alignment stage, which many people are aware of, and this is the starting point that many parents think that their child needs braces. This is the alignment or the straightening of not only just the front teeth, but also the incoming adult back teeth. We start this treatment at around 10 years old, depending on the child, when those side teeth are starting to erupt. We use Invisalign to guide and correct each adult teeth as it's growing in, and to position it in the ideal place. Once all the adult teeth are in the mouth, including the second molars, we then hold everything in position using bonded lingual wire retainers and removable nighttime retainers. In case you're not familiar, this is generally how Invisalign works. Invisalign is a sequence of aligner clear trays that are taken in and out of the mouth. We tell the child that they need to imagine that they are stuck onto their teeth. They are worn 20 plus hours a day, and they can be taken out to eat if preferred. they absolutely will brush and floss their teeth with it out, which leads to an increase in hygiene throughout orthodontic treatment. We also place white attachments on the teeth that parents often call grips or buttons. These hold the aligners on in place very tightly so that they can't be played around with by the child. If the child needs it, we will also add elastics or bite blocks to help control the growth of their jaw during treatment. Unlike with fixed braces, appointments are a lot less frequent with Invisalign. In person, the appointments are roughly every 3 to 6 months, depending on the child's growth. There are little to no emergencies during aligner treatment, and treatment is quite comfortable for children. We also track each child using a dental monitoring virtual mobile app. This allows me to see the position of the teeth and also the hygiene of the child throughout treatment. Some of these ideas might be quite new for you, so let's go through some of the common questions that I frequently get at the clinic. The first one is, really, Invisalign for kids? I've never heard of that. You will be surprised to know that over 5 million kids and teens have been treated successfully with Invisalign. At our office, we find these children are excellent patients and often surpass the parents that we see in treatment also. We also get asked, will my child actually wear it? We find that this young pre-teen age group are very compliant. They are still very interested in their parents' input in their lives, and their compliance is much higher than later in the teen years. We also get asked, will my child need braces later? No, this is an alternative to braces treatment. If we start early, we can prevent your child from needing later orthodontic treatment. What if they lose their aligners? Well, the good news is that each aligner is switched out every 4 days, so even if they lose it, they just moved on. What about eating? They have the option. They can take it in and out for eating, but we also always recommend that they have it out for any sugary treats and also obviously for brushing. Hygiene is easier and we see far less cavities being grown during Invisalign treatment compared to braces. I hope this has been helpful and that it has sparked your interest in considering Invisalign as an option for your child's orthodontic care. If you're wondering if your child is ready, first what we look for is the child to be 7 years and above with 4 or more front teeth. This allows the expander and the aligners to fit very well and for treatment to be as short and efficient as possible. You can book a consultation with me, Dr. Aisling Whitaker, at Bitehaus Dental on St Clair Tuesdays and Thursdays or at Hillsdale on Wednesdays. We do offer direct billing to insurance and payment plans are available if needed. I look forward to seeing you then.